Good morning, Dr. Stotter. It's a pleasure having you here. We appreciate your time coming in. You are involved in research in orthopedics, traumatology and sports medicine, but currently you are at Landesklinikum Mödling. Can you tell us a bit more about your role there?
Good morning, thanks for having me. Currently I'm working at the Landesklinikum Mödling in Lower Austria at the Department for Orthopedics and Traumatology. And my personal focus is knee surgery, both joint preserving and arthroplasty, but also cartilage repair and sports medicine. And our hospital is divided in two sites. On the one side in Baden, we focus on trauma surgery, emergency care, and at Mödling we focus on orthopedic surgery. And this is where I work now. And beside that, we do a little research, and our hospital is a research center in collaboration with the Danube University. And there's my part of taking care of the research projects that we're running now.
We are still feeling the impact of the global pandemic. Were there any significant changes to your scope of work, your role and your responsibilities due to it?
Without a doubt, the COVID pandemic has had a serious impact on all of our lives, and it has also affected my professional scope of work, of course. During the pandemic, we had to focus more on emergency care unit, and we had to cancel a lot of elective surgeries. And if we want to see some positive aspects of the pandemic, the scientific community has evolved a lot during the pandemic. And research findings have been made public in a quicker way, and I think we can profit from this in the future.
Interesting. What is the current image reading setup at Landesklinikum Mödling? Who does the image reading?
The image reading is performed by radiologists, but also by orthopedic surgeons, depending on the image modality. We do the readings using our PACS system, and we have really close collaboration where we have daily interdisciplinary meetings for case discussions between radiologists and orthopedics.
What are the challenges that you face in the current orthopedic diagnostics workflow? Where do you see room for improvement?
The current orthopedics diagnostics workflow can be sometimes time-consuming. And especially the assessment of images can be time consuming if we want to make a detailed analysis of certain images. And I think in the future we could benefit from AI applications in terms of increasing reproducibility, accuracy, but also saving time during diagnostics. And additional to that, we see a high inter- and intra-observer variability. And I think this can also be improved using new technologies.
In your opinion, where do you see, or what is the current three trends in orthopedics?
The three main trends in orthopedics, and there are many evolving fields. I would name the orthobiologics, because we've learned a lot from the basic research side, and we will benefit from those findings for clinical applications in the next years. Then robotics. Robotics has been there for decades, but with current new technologies, it has improved, and it will find, I think, increasing usage in orthopedic surgery. And the third field is the large field of digitalization and AI.
I'm glad you're touching base on artificial intelligence in orthopedics. What are your experience with the use of AI in orthopedics? In what part of your daily workflow do you see AI supporting you?
I'm currently involved in a research project focusing on AI in orthopedic imaging. And so I have quite some experience using AI. And I think it will affect the way that we assess images, and it will definitely affect our diagnostic workflow, and the patients will be able to benefit from these technologies in the near future.
Do you see any potential barriers in the adoption of AI solutions in orthopedic diagnostics?
There are definitely some barriers. One is the personal reservations from physicians using this new technology, but also from patients trusting new technologies. And the other barrier would be just the technical side, so technical improvements of this technology that needs to be solved for further development.
According to many medical experts, AI is the future of image diagnostics. What do you think? Can AI really have a lasting impact in orthopedic imaging?
Yeah, I'm convinced that AI will have a lasting impact on orthopedic imaging. We just have to get past those barriers that we have mentioned, and I think in the near future patients will be benefit from this new technology, and it will improve our clinical workflow.
I agree, and I think we all have a role to play in developing technology in the medical field forward. Thank you once again for your time in joining us, and wish you a great day further. Thank you, Doctor.
Thank you.